Now at 4, your community focus. We're talking COVID-19 today with Dr. Jim McDonald from the Rhode Island Department of Health.
He joins us every week right here on 12 News Now at 4. Thanks for being with us today.
Brian and Kim, it's great to be here as always. Thank you so much for having us here.
Dr. M, today we learned that the state expects 70% of people 16 and older to be fully vaccinated by sometime in June, and then more large-scale events will be allowed, which is certainly good news. But I know the health director also said that we'll still be expected to wear masks at those events. So I guess I have a two-part question. Why will mask wearing still be required when so many people will be vaccinated, and when might that change?
Yeah, so it's the right question, right? Because I think everybody wants to get rid of masks. Hey, guess what? I do too. So as far as mask wearing, why? It's a great vaccine. We have great vaccines, but they're not 100% effective. And there's still going to be a large unvaccinated population. So I do expect we're going to get to our goal, but you need to wear a mask still because there's still going to be a lot of people who are unvaccinated. The mask I'm showing you right now is the KN95 we're actually handing out at our state testing sites. I got myself tested Saturday. I was negative, but the person said, hey, do you want a mask? I said, I'd love one, and because I wanted to show it to you on Channel 12 today. So there you go. So you can get a free mask. You go to portal.ri.gov, you sign up for a test, you will get a free mask.
It doesn't hurt to have an extra one, that's for sure. This afternoon, Dr. Alexander Scott certainly emphasized the importance of getting the vaccine to the point you were just saying. No shortage of people we know hoping to score perhaps a leftover dose at the end of the day. What can you tell us about what is happening right now with doses if there's a no-show for an appointment? And is there a large percentage of no-shows right now?
Yeah, the no-show percentage is very slight. It's not very big. But some people do score that extra dose. Like if you live close to a pharmacy that's giving vaccines, and you call them and say, look, if you have a no-show, I'll be there within 10 minutes, guaranteed. They might call you and set you up. And the municipal sites do that as well. They have lists of people who say, you know, if you have a leftover dose, I'll be there. But there's very small percentage of leftover doses. Demand's still high, but compliance, in other words, people come and get the vaccines is really good, which, by the way, we are very thankful for because there's nothing like setting a table, having a big party, and then when people don't come, we're bummed out. So we're so glad people are coming for the vaccine appointments. It really helps us.
Dr. M, Dr. Nicole Alexander Scott said earlier today that 19 out of the 39 cities and towns in Rhode Island had an increase in cases in the last 5 weeks. The state previously pointed to those small social gatherings where we maybe took our masks off as the source of the spread. And nationally, the CDC, we mentioned earlier in our show, is blaming youth sports. What are we seeing here?
Yeah, so I think what we're seeing here is what we expected from the variant. That B117 variant is now the dominant strain in Rhode Island. In other words, if you've got COVID today, more than half the folks, it's the B17 variant. What we're seeing is it's just a lot more contagious. And because it's more contagious, more people get it more easily. So if you let your guard down a little bit, or you're just living in the house with somebody, this happens. I don't want to blame anybody. I certainly don't want to blame youth sports because youth sports have not been a big problem in Rhode Island. Oh, sure, we're seeing some cases, but they really haven't been a big problem. I think the one big thing to keep in mind, though, is that we're seeing younger people getting more cases and younger people in the hospital. That's, again, part of the B117 variant. It's a little more severe, so it's more contagious and more severe. That's why we're seeing a slight uptick in hospitalizations and the younger people in the hospital, too.
And Dr. McDonald, we know that there is a population of people who will choose not to get the vaccine for any number of reasons. What's your message to that population in terms of keeping themselves safe, but also not contributing to the spread of the virus still?
Yeah, and you know, there are people who we need to build vaccine confidence in. And I think one of the things I'm taking as my job is I'm going to try to build vaccine confidence in as many people as I can. I'm going to do my best. For those folks who don't have that vaccine confidence yet, really more important to wear a mask, stay 6 feet apart. But also, keep in mind, we will have a respectful conversation with anybody. At the Department of Health, we just will talk to anybody about anything. Sunday, for example, I'm going to be at a temple talking about vaccine and vaccine confidence. So obviously, I'm available for rental, free, of charge. Dr. Chan as well. Part of what I'm saying is if you have a group and you'd like to have us talk to you, email the Department of Health. We'll see what's possible. I've never said no to anybody who asked me to give a talk. I find a way to be available for anybody.
And we certainly appreciate that, Dr. M. Dr. M, we've got about 15 seconds left, but I just wanted to try and pinpoint something from the top of our conversation. 70% vaccinated, still wearing masks. What percentage of folks do we need to get to before we can get rid of them?
Hard to say for sure because it's really dependent on how many people get the vaccine, but you're asking an honest question. I'd like to see 85% or more. That'd be my guess today.
All right, Dr. Jim McDonald from the Rhode Island Department of Health, thank you so much for your time.
Thank you. Happy everything.
Happy everything.